Good morning, America. This is the Cats Roundtable, and this is John Catsimatides, and it's Memorial Day weekend. And this weekend, we respect all our vets, we respect all our soldiers, we respect all the people that fight for us to make us, to be safe, to have this weekend. With us this morning is Dr. Philip Stieg, and he is chairman of the Weill Cornell Brain and Spine Center and the head of the neurosurgery department. Good morning, Dr. Stieg. How are you this morning?
I'm doing really well, John. Thanks so much for having me on the air.
Now, there's so many problems with our soldiers coming back from Iraq, from Afghanistan, with this post-traumatic stress disorder. And I understand you are one of the experts. And, it's easy. I mean, when we had Vietnam 50 years ago, or Korea, people got killed, we never kept track like this. But now it comes down to a science. And tell us about it. You're the expert.
Well, what it is, post-traumatic stress disorder is a response to either a severe traumatic injury like a blast or a severe traumatic, in a different way, emotional response. And it's not only seen in veterans. We have children that are victims of child abuse or childhood trauma, people that live in chronic adversity, or they have incredible family stressors, death of a very dear relative. Many of these different kinds of events in our lives, aside from just a blast effect, where a bomb goes off 2 feet from us and we live through it, can cause a post-traumatic stress disorder.
And I guess, coming back to what happened in the UK at the rock and roll, I'm old-fashioned, I call it rock and roll, at that concert. Are those people that heard the blast and were so near to it and probably traumatized if they weren't hurt by it, how are they affected?
Certainly many of them are at risk for post-traumatic stress disorder, either from the direct effect of the blast, which, again, and the way that works is when a bomb goes off, there's a sudden, violent exertion of force, airwaves, and in this the case, the materials that's blowing around. Your body gets thrown. Your brain, which is trapped within your skull, gets shaken, and it's suspended in fluid, basically. And it's that violent shaking motion that can result in injury to the brain. It manifests itself in delayed fashion in this post-traumatic stress disorder. But also, imagine if you're standing next to your loved one and they're blown to bits by this bomb. That has incredible emotional impact on you, and that also can result in changes in the neurochemistry of your brain. It doesn't cause direct blunt trauma like a blast does, but it can change the neurochemistry in your brain such that you have this prolonged episode called post-traumatic stress disorder.
Now, you're a doctor in the Upper East Side of New York City in Manhattan. How much of this do you see?
Don't see much of it. I see a lot of mild traumatic brain injury now. I personally, in neurosurgery, don't see a lot of post-traumatic stress disorder. I did see more of it when I worked in a Veterans Administration hospital, particularly when I was younger. It was the Vietnam era. You saw a lot of it, and that's where we became much more aware of it. And now, with many of the veterans coming back from Iraq, we're also seeing quite a bit of it. So it's a part of the reason you didn't hear about it so much back in the 50s is because we didn't really look, and I don't think that people talked about it. I think that now we've become aware and we're starting to look. There's the recent study done by the military looking at the troops that have been discharged discharged for misconduct, demonstrating that a large number of the troops should have been diagnosed with post-traumatic stress disorder.
Now, is this what's causing some of the suicides? As much as 20 suicides a day by vets?
Well, in medicine, we never say never, and we never say always. One of the things I think we have to say is that there are individuals that are predisposed to post-traumatic stress disorder, just like when I see a patient with a concussion. Some of those patients are predisposed, meaning that they have attention deficit disorder, they have sleep disorders, they have mood disorders. For PTSD, they've had, well, the things that I listed before, some traumatic event in their life. They have a premorbid psychiatric history. So I can't say that PTSD is the cause for all of the suicides, but common sense would have to state that one of the effects of PTSD is that a patient can be, or a vet can be, depressed, and as a result of this depression, they might have suicidal ideation, and it can lead to that event.
Now, I'm going to go into a different direction other than vets because it's important to all people with children. Boxing, football, and you get your brains beat in. That was the old expression. And somebody with a hard punch keeps hitting you in the head.
Yep.
I mean, I never
the more
wanted
current
my
sport
son...
is the mixed martial arts. And, there's very clear data in the boxing literature about the impact of having repeated blows to the head. It used to be referred to as being punch drunk, dementia pugilistica. Now there's concern, obviously, in professional football about the impact of repeated concussions, and there's discussions about how is that related to the disease process called chronic traumatic encephalopathy. But I think it gets back to the concept again of, we know that repeated blows, high impact blows to the brain, are not good for you, and one of the impacts that this can have on your life, again, is the mood disorders, behavioral disorders, depression, sleeping disorders, concentration disorders, sleep changes, as I said. And one of the things that happens in PTSD is the troops can have flashbacks where it frequently pops up in their mind, and then it exerts the violent reaction that one has to the event. Professional football players, hockey players, boxers, they can have headaches. So all of these things can remind them of of events that are not pleasurable.
Now, I mean, I know I'm a member of the board of the Police Athletic League, and we shot down boxing because we didn't want our 14-year-old kids getting their so-called brains beat in and turning them into what's the nicest way to say it? I mean, losing their what's the nicest way you could say it?
Well, I mean, they lose their judgment, because you take repeated blows to what's called your frontal lobes. It's on your forehead. It's your prefrontal cortex. And in the developing brain, and certainly in boys, in males, your brain isn't fully developed until you're about 25. Women's brains develop a little bit earlier, 18 to 20. But, and children are more susceptible to concussive kinds of blows. So I totally agree with you, and so do other people. You know that in soccer now they've eliminated heading of the ball until I believe it's the age of 14 now.
Wow. Anything else? So we have a minute left. Do you have anything else to tell America on Memorial Day weekend?
Well, I want to reassure people with PTSD that there are new and excellent treatments out there, and certainly the vets shouldn't give up and on getting help. In most cases, in people that didn't have premorbid conditions like psychiatric disorders, they are going to get better. Obviously, if they had the conditions, or if as a result of the PTSD they got into drugs and alcohol, that makes it more difficult. but I would urge them all to seek help because it is a reversible condition.
Dr. Philip Stieg, Chairman of Weill Brain and Spine Center, Head of Neurosurgery, thank you so much for being with us this Sunday morning. Have a great Memorial Day weekend.
You too, John. Thanks for having me.